All right, here's a brief introduction to an evidence table. The evidence table is really about getting all the evidence in one place where you can look at the similarities or the differences that illustrate the trends or support the next steps to whatever your clinical practice or your research question is. When I say clinical practice question, I'm oftentimes talking about that PICOT, the PICOT question, which we can go over later. But properly constructed evidence tables definitely they effectively convey those results, so another reader can look at them and see these trends, what is going on related to the question that you are asking. It really makes sense of the data and it just organizes it clearly. So let's quickly, one of the things, several things when you're looking at the literature as you build your evidence table is, what is the clinical practice question or the research question? Keep that in your mind up in the forefront. So 3 questions when we're looking at research evidence. We want to look at, are the results valid? Are the results reliable? And will they help me with patient care? And then these little bullets explain what that means. Very importantly, you need to rate the level of evidence and the quality of evidence. And whatever tool you utilize, here we're going to use the Johns Hopkins tool. But whatever tool you utilize, you also need to have that so other readers can clearly understand what your standard was. Okay, so in this basic table, the blue font is for research and the green font is for non-research. And non-research can be your clinical practice guidelines, literature reviews that you see out there, CI projects, spray literature, things like that. Okay, so the first column here is the authors, the date of publication, the title, and put the DOI in there if possible. We want to make sure that your reader can get to this. The purpose, this is the why. Why was this done? So, and this goes for both research and non-research. Very important, you may, if you want, you can put in the research question itself or the evidence-based practice question, the hypotheses, etc. The study design, very important. Again, we want to call out as high of level of evidence as we can to be able to make a practice change or look at that research as well. But we really need to make sure the research fits the purpose of whatever the research study was about. So here we want to look at the study design or method. With the non-research here, you can look at type of evidence. Was the peer review process? Were there expert developers? Things like that. They need to explain the processes and how they got to what the end result was or their recommendation. Okay, sample size and setting, very important. Get your total in there. Where was the study conducted? Was it just at a single site or was it more? Possibly, sometimes it may be important for you to address attrition rates in studies and why that occurred. So major variables, very important, your independent and your dependent. Sometimes it's hard to list them all, but no matter what you list, you make sure you address as you move through the rest of the table as well. So remember your independent variables are your explanatory, predictor, or covariate variables. Those are the ones being controlled or manipulated by the researcher. And then the DV is often referred to as the outcome variable. That is what is affected by the independent variable. So the measurement of variables, that's your scales, your tools, your instruments, whatever you were utilizing in say, a quantitative study, what scale were you utilizing to measure your variables? And the other thing that's really important is people should list internal reliability for whatever their scale is. A common one is the Cronbach's alpha, and that is usually, we'll go over that more so when we talk about this, but anything greater than 7 is acceptable. Synthesis of evidence. How did they synthesize this evidence? That's important for the non-research information. So data analysis, what were the stats used? Do you need to list them all? Just depends. Probably not. But you really do need to address important ones that were utilized to answer that research or clinical question. Just list the name of the stat period. You don't have to go into detail. And for here, with your non-research, if it was, for example, a guideline, was it reviewed? How was it tested for clinical practice guidelines? Those types of things. Okay, with study findings, anything you listed statistically here, you need to address over here. Okay, so Here, use abbreviations as much as possible, but you really want to talk about effect size and the P. And see, the biggest thing with data analysis and study findings, again, were the tests utilized and analysis appropriate for the study findings. With clinical or with non-research data, we really want to look at recommendations as well, because you didn't, of course, do the statistical analyses. So the level of evidence and the quality of evidence is critical, because we want to make sure we're pulling in proper evidence. If we're going to make a clinical decision based off of just purely literature reviews, case reports, things like that, that's probably not a good decision. So we need to call out that evidence. And then lastly, we need to look at worth to practice. Is it feasible? What are the strengths and weaknesses? This is your recommendation. This isn't their recommendation. This is what you truly find when you synthesize that evidence, period. So very important. So that's why it's important when you're making a recommendation to make sure you have solid information over here and what's going on. The thing I think to remember is very important is if you have poor level of evidence or the research is not that great to support a practice change, then at this point in time, more research period needs to be done. But you have great evidence, solid evidence, high-level evidence, then you can make a practice change. And I think that's what we're talking about with evidence-based practice, especially with lit reviews or tables, evidence tables. If you see the research, it's clear, it's good, solid, then you make the practice change. If you don't, then somebody better be doing some research. Okay, more later.